A real pleasure to welcome to the big round table this morning the medical director for ABQ Health Partners Bariatrics, Dr. Ryan Tyner, is joining us here this morning on the show. And Dr. Tyner, welcome to the Morning Brew.
Thank you very much for having me.
Nice to have you. This is all about bariatric surgery, which is an all-encompassing term for
weight loss surgery.
Yeah.
What we're looking at is a bunch of different surgical options that allow patients who are overweight and have weight-related medical problems to obtain long-term, sustained, and durable weight loss.
When we say weight problems, it's not just 20 pounds, 30 pounds, it's excessive amounts.
Absolutely. So when we talk about patients who would be a candidate for bariatric surgery, we talk about things like the body mass index. Body mass index is a ratio looking at height versus weight to standardize patients of different sizes. When we talk about bariatric surgery, we're looking at patients who fall into the category described as morbidly obese, which is a body mass index of 40 or greater. When we say morbidly obese, we mean you're overweight, and that extra weight that you're carrying around could cause big problems in terms of your health and health complications. For bariatric surgery, we also do it if your body mass index is greater than 35 and you have some of those serious weight-related medical problems. Those big things are diabetes, high blood pressure, high cholesterol, sleep apnea, fatty liver, reflux disease. All of those things we can dramatically improve or resolve with different weight loss surgeries.
Now, this is a new development to have a comprehensive approach to this in Albuquerque. Previously, you could get some of these kind of surgeries here, but not the overall approach. A lot of people had to leave the state.
That's very true. In the past, patients were going to El Paso or to Colorado where they got wonderful care, but it's really nice for them to be able to see a physician here in town, have all these different options, and then know if they had questions, problems, or concerns down the road that we're always available to take care of them.
And there's also follow-up, so it's not just you have surgery and that's it.
And that's really important. When we talk about bariatric surgery, you have the operation, but you also have a lifelong course where you're looking after your weight, watching your health, and all those different things. And when you're able to see your surgeon all the time, regularly, I think that makes a big difference in your long-term outcomes.
I was asking you before the show, what kind of history do we have with these kind of procedures? One of the procedures has been around about 30 years, right?
That's correct. So when we talk about the gastric bypass, which now is done laparoscopically, meaning with little incisions, and what we're doing with that operation is we make the stomach smaller so you feel full and satisfied with very small portions.
Is that stapling the stomach? Is that what they used to do? Or?
The common term of stomach stapling probably describes a previous and obsolete surgery called the vertical banded gastroplasty. But it's that general idea. So we do make the stomach a lot smaller, we bypass the segment of the stomach and intestines, and the combination of those two things gives you dramatic results in terms of weight loss. You can lose up to 70 or maybe even 75% of your excess body weight. And most importantly, it has just dramatic results in terms of resolution of things like diabetes. And that surgery has been around for about 30 years now.
What's usually the time span from when somebody gets a surgery to actually them seeing a change?
So in terms of, for example, the laparoscopic gastric bypass, if the patient has, let's say, diabetes, we oftentimes see resolution of their diabetes by the time they leave the hospital, 1 to 2 days after surgery. And that's related to hormonal changes that happen when we bypass that segment of the intestines. When we talk about the weight loss, that takes a little bit longer. So for example, the weight loss with the gastric bypass in general happens over about a year, about 12 months is when we see the weight loss.
What does it feel like for the patient? What are they experiencing? They're not hungry, or what's the sensation that they're...
So in general, and it depends a little bit on which operation you have, but the idea behind these surgeries is that we're not taking away your hunger. You still get hungry, you still crave food, you still want to eat things, and that's good and healthy. But what we're changing is the amount of food that it takes to make you feel full and satisfied. What patients often describe to me after, again, for example, the gastric bypass, is that they'll have 5 to 7 very small bites of food, really well chewed, and they describe themselves as being as full as if they'd had the biggest turkey dinner of their life. And so then, instead of feeling like you're dieting, you're trying to lose weight for the rest of your life, what in fact you feel like is, I'm satisfied with a small amount of food, I make smart choices about what I eat, but in general they eat relatively normal food, they just eat it in moderation and in very small portions.
ABQ Health Partners is doing some monthly seminars on this, so you can come and get info from the doctors themselves, yourself included.
That's true. We offer seminars several times a month They're at different locations to try to make it as convenient for patients as possible. It's roughly an hour-long session where we talk all about bariatric surgery, who's a candidate, what operations we offer, which operations are best for which patients, and then give them an idea of what the next step would be for them so they can hopefully get really excited and enthusiastic about this new lease on
This
life.
is such a
This
big
is amazing.
life changer for a lot of people, and I'm really glad you guys are offering this. It's great to meet you.
Thank you.
And have you on the program, and anytime you want to come back and cover this again, we'd love to have you.
Thank you very much.
Thanks.